My name is Elise Park. I'm director of HIPPR, which is the Health Promotion Resiliency Intervention Research Center. We're just so delighted that you could join us tonight for Dr. Perez's discussion on psychosocial needs of individuals with rare diseases. Dr. Perez is a clinical health psychologist and an assistant professor of psychiatry at Harvard Medical School. She is at HIPPR. She's the associate director of community belonging, engagement, and research programs. And she is she oversees the research at the MGH Adolescent and Young Adult Survivorship Program at the Mass General Cancer Institute, Mass General Brigham Cancer Institute. We thank you for joining us today. If you have questions, we can put them in the chat, Annika.
There's a Q&A feature at the top of your screen.
I know there's a Q&A feature. If folks can look at that and use that, and pleased to present Dr. Perez.
Thank you so much. It's great to have everybody here. I'm going to share my screen, and as per usual, I'm going to make sure that it is visible. And
looks great, Giselle.
Awesome. Wonderful. All right. So thank you all again. It's really wonderful to be here. I'm honored that you chose to come to this topic that is really near and dear to me. It places a spotlight on our patients' psychosocial needs and highlights why we should care and what tools we can use to essentially optimize their well-being. And so the roadmap for today of what you can expect, we'll talk briefly about why we should focus on rare disease and what we actually mean by psychosocial needs. And I think that's really important because that term is thrown around quite often, but I believe that there's a lack of understanding of what it is that we intend to communicate when we say psychosocial needs. We'll talk about why it matters and where resilience fits into that. And then hopefully throughout, you'll also learn a few strategies, what you can do to help address psychosocial needs and also improve emotional well-being. So let's start with the why. I like to call this my hashtag my why. Essentially, it's what makes me passionate about the work that I do. As a disparities in health services researcher, my goal has always been to identify ways to increase care access and health outcomes amongst populations that are often overlooked by our medical system, individuals who might be most vulnerable to experiencing a variety of stressors that severely impact their quality of life. And that's what brings me really to rare disease. By definition, a rare disease is one that affects a small percentage of the population. According to NORD, the National Organization for Rare Disorders, this translates into a disease that's diagnosed in perhaps fewer than 200,000 individuals when it comes to the US. And when we think about rare disease, collectively, individuals who are diagnosed with a rare disease experience a broad array of clinical challenges. For many, symptoms may be chronic, generalized, nonspecific. Many of these have a genetic basis, and thus they often present in childhood. And for that reason, the consequences of their challenges can be more long-term. Because rare disease, by definition, affects so few people, research is also limited. This leaves us with little understanding of the clinical presentation of many of these diseases and the trajectory of the disease, as well as the treatment implications. This also could mean that people may suffer with symptoms for many years and endure multiple tests before they receive a diagnosis. And then due to the limited research, treatments don't see the same level of progress as we might see in those that are more common when it comes to medical conditions. And so for this reason, patients find themselves living in a state of chronic uncertainty. And besides those clinical challenges, a rare disease significantly impacts one's quality of life, one's emotional, social, financial, professional well-being. One population that I've been working with for quite a few years now, are patients living with von Hippel-Lindau disease, VHL. And I'm going to use that population as an example. Individuals who are diagnosed with VHL experience a lifetime risk of developing multiple cysts and tumors, some benign, some malignant, anywhere throughout their body at any point in their lifetime. These tumors and cysts may commonly present first in time in people's early 20s, but manifestations can occur at any point throughout the life stage, from early childhood through later adulthood. And there's no prevention really that patients can take. So what they often have to do is engage in lifelong whole body surveillance, right? Frequent MRIs. And what happens is that individuals with this specific disease, with VHL, live knowing that they're going to have a manifestation pop up, a tumor, a lesion, a cyst at some point. And it could be multiple. They just don't know when or where it will happen. And so when you start thinking about that, the challenges of living with VHL, like so many rare diseases, is far reaching. What happens is, because of their disease, patients may have to experience short and long-term work absences. They may have high costs that are linked to medical procedures. They may have travel burdens because a lot of the specialty centers aren't necessarily nearby. And so they have to travel quite far to see a specialist. They might experience financial burden because of the work absences, because of the travel. They may have physical or functional changes that come about because of the medical procedures. Then there's the familial implications, right? Many may feel guilt about potentially passing on this disease onto their offspring. And then, of course, because a lot of these, especially for VHL, has a genetic basis, many patients themselves become caregivers. And for that reason, they experience the multiplicative effects of having a disease and also caring for someone who's living with it. And so what this does is it places individuals at high risk for chronic distress. And then, of course, the social experience. Living with a rare disease may leave people feeling isolated, alone in their experiences. People don't understand. Sometimes there's sort of a hidden, stigma that happens where people might not be able to see on the outside what is actually happening on the inside. Connecting with others may be harder, not because there's a lack of empathy, but maybe a difficulty relating. There's a sense of wanting to be understood, but not pitied. And there's also a decreased tolerance of the challenges that others may face when compared to one's own. So as I do with my work, I reflect on my patients' stories. I appreciate so much my patients' stories. And I imagine, what must it be like to live with a rare disease where so few can understand this often hidden experience? I certainly don't pretend to know, but I can share what my patients tell me. And I'm sharing this here from a study that I've recently started with patients who are living with von Hippel-Lindau disease. And essentially what I've learned is that living with VHL, or any other rare disease for that matter, is much like living life interrupted. And then add the general stressors of life. We don't have to go very far to see how the social, political, and economical environment can impact all of us. And so an individual who's living with rare disease experiences all of these demands, but one that is colored by the illness experience. So why do I bring this up? We have the why, but then what does all this mean? All of these stressors, the disease-specific and the non-specific stressors, can leave people living in a chronically stressed state that over time can impact their well-being. Even more concerning is that these stressors are exacerbated by the many barriers that patients face to getting their psychosocial care needs met. These barriers can include limited understanding by providers about what psychosocial needs mean, or the fact that patients may have these needs. And so that leads to a lack of referrals, or even asking about patients' needs. And what happens is that individuals feel overlooked or misunderstood. Then there's the stigma that's related to their disease, or even about having distress. People feel hesitant to share how they're feeling. And they sometimes wonder, am I doing this wrong? Should I be feeling differently? There's a lack of tailored services or specialty providers that understand how best to support individuals living with rare disease. That's a barrier. For instance, as a psychologist, our kind of gold standard for treatment is cognitive behavioral treatment. However, if delivered in this context, it could actually be harmful and invalidating. Financial barriers, travel barriers, all those things pose an obstacle even when individuals want support. And so left with multiple unmet needs, individuals who are living with rare disease are at risk of experiencing chronic emotional distress. And So I want to stop there by kind of making sure we're all on the same page by by describing what I mean by psychosocial needs, right? When we refer to psychosocial needs, we're referring to the emotional, the social, the psychological, informational, the practical factors, all of those things that impact a person's quality of life and well-being. All right. So as you see, it goes beyond just one's physical health and it focuses on the things that individuals need to feel safe, connected, valued, able to cope with all of life's challenges, especially in the context of illness and stress. And so I lay this out to demonstrate just how much actually falls under the umbrella of psychosocial needs. So from the emotional components, feeling understood, validated, loved. Social, it's connecting with others. It's understanding shifts and addressing shifts in social roles. Practical, it's financial stress, it's work, school disruption, all of these things that can happen in the midst of rare disease. The reason it's so important, though, and to understand our definition of psychosocial needs is because it establishes a foundation, right? It's a foundation that essentially enables you to manage all of the challenges of rare disease. And in doing that, you're able to promote better health. And I think of it as weathering a storm, right? If you're lacking psychosocial needs, you're going to look a lot like, you have gaps like that building on the left side. If there's just enough wind, you can see how that might collapse. And similarly on the right, there's a balancing act that's happening and at some point it's going to tilt. However, when you have your needs met, regardless of how much wind or how hard that storm might be, there's a solid foundation that enables you to sustain the storm. And so providing psychosocial support is a way of establishing that foundation. And so what it looks like might be insurance navigation, financial counseling, family planning, benefits assessment, caregiver support, and so on, and so on, and so on, right? I'm just naming a few potential categories. Why does it matter other than, again, weathering the storm? Why should we care? Well, when your psychosocial needs aren't met, you activate your body's alarm system, right? The house is on fire, the alarms go off. Why? Because that's intended to keep us safe. And our body is designed to help in these situations, right? That's why that alarm goes off, because what happens when our alarm system is ringing, what it does is it allows our body to shut down resources and move them to the places that we need to keep us safe. That's essentially in its most simplest form. And so blood may be moved away from places you don't need to fight danger, like your stomach, your hands, and your feet, and it's moved to places that you need to defend yourself, like the major muscles group, right? So you need your big muscles to function. You need your legs, you need your back. You don't need to digest food, and actually that's a misuse of resources. But what that feels like is cold fingers, a pounding heart, headache, dizziness, breathlessness, right? Many of these symptoms actually mirror a lot of the symptoms of disease progression. And hence, there goes our alarm reaction again, our alarm system. And each person's alarm looks different. Some signals are stronger than others. Think about a time you recognized that you were feeling stressed. What did you notice? Many people often notice changes in how they're feeling. Sometimes they notice they're upset or they're overwhelmed. Others might notice changes in how they're feeling. But part of our work, and later on we'll talk about programs that we use, it's understanding what is our alarm system? What is an indication that maybe the house is on fire? So back to our alarm. It makes sense that we want it to work well, right? Especially if we're being chased by a lion or a tiger or a bear. Oh my. But the problem is if that alarm system goes off when there's traffic, when you're food shopping, when you're thinking about work or you're waiting for a call, when you're thinking about everything else that needs to happen, all of these things trigger the same alarm reaction, that same physiological response that I described to you as would happen if you were faced with real danger. And in fact, our brains can't always tell the difference between the two. And so those worries that we described, those specific disease-specific and non-specific stressors, those factors can all keep us in a chronically stressed state. The good news is our alarm system will shut off. It doesn't last very long because our body is constantly trying to help us. And so it does what it needs to do. And, there are reactions that happen within that shuts off that stress response. However, continued activation, deactivation of the stress response can overload our body. Think about a machine. What happens when you shut it on and off, ultimately it will break down. And this happens, right? Because at the end of a vacation, what happens? Sometimes you get sick because good stress and bad stress still activates that alarm reaction, depending on many factors. But the term allostatic load refers to that wear and tear that stress can have on our body, because essentially what is happening is our body's working overtime. And that's essentially how chronic unmanaged stress can lead to impairments in quality of life and overall health outcomes. And so the downstream consequences are many, right? So we see that there's impaired functioning, there's avoidance of care, so behavioral changes, there's changes in our health, right, and our immune functioning. And so I hope at this point I haven't worried you too much, because there are things that we can do. The first thing I do when I work with my patients, or when I work with individuals who are presenting to me with a rare or complex medical illness, is I help them understand you're not alone. And this is so, so important. How can you not feel what you're feeling in the context of disease, right? In the context of uncertainty. And the fact that people don't talk about it because there's a level of unknown, uncertainty, a lack of clarity about it, it leads us to feel alone. And so part of it is normalizing that experience, understanding why people might not ask, understanding that it's normal, it's an expected way, right? The first thing I tell my patients is emotions are not to be feared. They're indicators. They tell us to take a pause and figure out what's happening, and let's explore eternally so that we can do something about it, right? The next thing I encourage people to do is to identify resources, and there are actually many. And hopefully, especially as we continue to do more of this work, we can have these resources available. Financial concerns, I find, are really, really huge in my VHL population, but also in other individuals who are going through rare disease for the reasons aforementioned. And so my healthcare finances, Triage Health, are two wonderful resources, in particular Triage Health. They're comprised of a legal team that provides free education on the legal and the practical issues of navigating complex illnesses. They're wonderful resources because they have webinars such as this one that gives you information for caregiving, for managing medical bills, for understanding health insurance, for instance. There's also raredisease.org. It's an advocacy organization that also helps you get access to medication, also offers support to caregivers, and Everyday Life Foundation.org. And these are just to name a few that are broadly available to individuals who are living with rare and complex medical illnesses. Another tool that I commonly find is helpful to individuals who I meet who are living with rare disease is aspects of communication. I find people tell me, oh, I have family members who I, want to express something, but I don't know how to express it to them. And sometimes that leads to conflict. Or people ask me about any updates on my disease and I don't want to talk about it. Or it could be a myriad of many different things. And so we talk about understanding really what is passive versus aggressive versus assertive communication. The reason behind that is because oftentimes people don't understand that communicating assertively is okay. It's a way of clearly indicating what your needs are, how you feel in a calm way. And when you communicate assertively, what you're doing is you're increasing the likelihood of being heard, right? And that helps increase your sense of efficacy. Assertive communication might be something like, I'd really appreciate if you can help me with fill in the blank. Oftentimes people, because they fear coming across too aggressive, they communicate passively, right? What that means is they expect people to read their minds. They might be unclear or say things indirectly, but the consequence of that is it leads them to be overlooked or dismissed. And so that leads to a sense of feeling a lack of efficacy. They might say something like, I'm so sorry to bother you. I know that things are busy. I'm hoping you can help, but I understand if you can't. Right? And then there's the aggressive communication, the harsh, the one that people try to often avoid, the harsh, hostile, the forceful tone. It feels intimidating. It could also be passive aggression. People hear a lot about. It's using a lot of sarcasm. And so those are some examples of ways that people may end up communicating aggressively. And that often happens when, sort of on the other extreme after passive communication happens for some time. Other skills that I often encourage people to use in efforts to communicate more directly are using sort of this acronym, or not acronym, but it's sort of describe the problem. So be very clear in what you want to say, express why it's important to you, make the request, clarify why it's important, and then listen and try to stay connected. It's a variation of what people might hear or have a common technique that is named Dear Man, a variation of this DBT technique. And so the way it comes across, so the way you would use language that you can specifically use would be something like, hey, I've been feeling overwhelmed lately. And I've noticed that when I bring things up, the conversation sometimes shifts to trying to fix it right away. I end up feeling kind of shut down, or like my emotions aren't really being heard. I know that's not your intention, but it leaves me feeling worse. What I really need when I talk about hard stuff is just someone to be there and to listen, not to solve it, not to tell me why I shouldn't feel that way. And it really helps me feel connected and supported when you just sit with me in it. I feel safer and more grounded that way. And so I get that you want to help. Honestly, listening without fixing is helping. And if it ever feels confusing, feel free to ask me, do you want me to listen or help? And that would mean a lot. I don't know if we have providers in the room, but providers, and this is some language that we also offer to providers in a recent publication that Dr. Park and I also published. And so things that they can say to help initiate these discussions. Broken record technique is a popular one that I share also with individuals who I work with. These are great tools that we can use when you want to advocate for yourself or to set a boundary, especially when it comes to difficult conversations. Like I said, oftentimes I have individuals who tell me, I have layers of support, and there are people who just keep texting me. They want to know. And I just don't want to engage in that discussion. I just don't want to do it right now because it's they don't understand, or they try to problem solve, right? And so what we say is, identify what you want to say and develop a sort of broken record response that you are happy to repeat. And so, like a broken record repeats a lyric, this technique is all about calmly and consistently repeating your point until it's acknowledged. So if someone says, have the doctors figured X out yet? You might say, thanks for asking, but I prefer not to talk about my health right now. And if they keep asking, you might say, thank you, I appreciate your concern, but I'm really not up to talking about it. Maybe we can change the subject to blank. So while meeting psychosocial needs lays the groundwork for resilience, we can go further, right? Again, resilience being withstanding that storm. When we think about resilience is not a fixed construct. It can be nurtured using a lot of the strategies, similar to what I've mentioned, and some additional ones that I'll present, and all within the context of living with long-term illness. So resilience programs, of one I'll mention that was developed by Dr. Park and colleagues, what they do is they help people adapt to stress and also thrive in the face of stress and uncertainty. And so mind-body medicine is one branch of practice that provides us with these very tools. What it does is it enhances our body's natural ability to cope with stress. And it has this understanding of this interconnectedness between the way we feel, the way we think, and the things that we do, and how all of these things have a significant impact on our bodies and our well-being. And what I always, tell my patients is, stress is our reality. And often, especially when we think about living with rare disease, often there are many things that are not changeable. But what we can do is work on the things that help tilt the balance towards health. And these resources that we talk about, they nurture our overall wellness, our mental and our physical. The way mind body practices work, remember I told you about that alarm reaction, that alarm that goes off in our bodies? The mind body practices work by deactivating that alarm system in our body, right? All the things that are going haywire are essentially brought back to baseline through elicitation of the relaxation response. And I often tell, one thing that I find to be really helpful when I'm a very visual person, is to think about a cup of water, which I don't know if you guys can see here, but pretend if you can see it, this cup of water is full of mud, right? And so when you're in the stress response, it's as if you're taking this glass of water that's full of mud. Mud represents our thoughts, and you're stirring that glass quite rapidly, right? If there's enough mud, it's going to look like that image on the left-hand side. No matter what, because it's stirring, 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 you're not going to be able to see through that glass. However, if you practice a relaxation response elicitation strategy, and I'll define that in a moment, it's that glass full of mud, right? But what you do is you settle the glass, right? And as the glass is settled on a table, that mud, those thoughts, they're still there. They don't go away, but they fall to the bottom. And so now you're able to see much more clearly. And that's essentially what it's like to be in the logical mind, where you're able to still have your thoughts are there, but you're able to rationalize and choose a response that's more consistent with how you want. You're able to think much more clearly. And so this brings me to the SMART program, the SMART 3RP, the Relaxation Response Resiliency Program. And this was developed by Dr. Park and colleagues. And the relaxation response serves as the basis of this program. And what it does is it uses a variety of cognitive behavioral, positive psychology, and mind-body tools to help individuals build their inner strengths, and help them build resilience. And there are aspects of this program that I'll kind of highlight, and also kind of variations that I've done to help support individuals who are living with rare disease. And we are currently using this program, or a variant of this program, for the Mind Body program for cancer survivors that is existing in the Cancer Center, and one that I'm hoping to also expand to individuals who are living with rare disease. I'm gonna, for the sake of time, not do a lemon imagery exercise, but I love this exercise. I actually do a variant this with my kids. I call it the jelly donut exercise. But the goal of this is to demonstrate, what we do is we go through kind of envisioning, entering a kitchen, and there's a lemon in the kitchen, and you cut the lemon, you bring it, and you take a bite. And it's so fascinating how quickly our body responds to that visualization. And it's therefore a way of showing you how connected our body and our minds are. And it does work with jelly donuts, because I was able to interest my kids in that process. But like I said, the central process of the SMART program, or one of the cornerstones, is the relaxation response. And much like the stress response, the relaxation response is a physiological response in our body, right? It's essentially the rest and relax part of our nervous system. And what our program teaches you is the main ingredients to create this response, right? And the first one being a mental focus, and the second one being a non-judgmental mind, right? And the repetitiveness of the mental focus creates the anchor. Again, visual person here. The way I envision it is a boat, that is anchored to shore. And the currents, if there's a strong current and the anchor isn't good, the boat's going to be pulled away, much like our thoughts, right? You're going to hang out at sea. However, if you find a strong enough anchor, no matter how strong those currents are, the boat stays anchored, right? And so that's the importance of finding the mental anchor, because ultimately the recognition that I try to highlight here is our thoughts are there, right? They're always going to be there, but finding that mental focus helps us achieve that experience of being centered, right? And so we're not doing it wrong because we recognize our thoughts are there. Rather, we just don't serve them tea. We don't hang with them. And so these relaxation response tools are tools that we can use when our mind is wandering to places of worries, such as disease worsening, physical deterioration, when there's progression. By calming our stress response, we're stopping that mental looping that we might find happens often in rumination. And so there are many different tools that you can use. I often say to my to people I'm working with, find the one that works for you, right? And almost anything can serve as your anchor as long as you're engaging it in a repetitive way. So I say, if you like to go for a walk, really go for a walk. Anchor your mind to the cadence of your footsteps or to the scene around you. And you might notice those moments when you've done that mindfully, you actually feel wonderful, as opposed to other moments when you've gone for a walk and it doesn't feel any different, right? And so that's what we try to engage when we're engaging the relaxation response. It's being in the moment, engaging that repetitive movement or mantra, and non-judgmentally acknowledging that thoughts are there and you're just going to let them be. What it's not, though, is avoidance. And we won't talk about avoidance today, but oftentimes people engage in avoidance, not thinking about something, but it becomes like a bad song, right? The more you avoid something, you increase that sense of threat. And so the thoughts actually come back with a vengeance. So practicing the relaxation response using these strategies is not engaging avoidance. I often use humor in my work. And so I often tell people, do something brief. There are some things that we call minis in this program. And, try to remind yourself to do it as often as possible. And I say, use Post-it notes to remind you of places that stress you out, and remind yourself, pause and take a couple of mindful deep breaths, right? And put that Post-it note everywhere, put it on your phone, put it on your door to your office, put it on your spouse's forehead if that must be. But whatever it is, just do what you need to be able to remind yourself, pause and breathe. It's another kind of thing that I've done with the program, a minor adaptation, is understanding how fatigue, which I find is also quite common in the individuals I work with, that I tend to work with. And fatigue itself creates the alarm reaction, right? It is a trigger, and it's also a manifestation of stress. And so part of our work is understanding our fatigue and intervening on fatigue, looking at activities that maybe we can do in the midst of fatigue that also lead to changes in how we're feeling, right? And then using that to manage and engage in activities that we find to be fulfilling. Because it's not always the degree of fatigue that is most impairing, but it's also the degree to which fatigue gets in the way of the things that we want to do for ourselves. And so by trying to understand it better and to optimize what we do so that we don't burn ourselves out, that enables us to manage the fatigue. Similarly, with social support, we talk about ways to understand our social network. The program, and I won't delve into this, talks about the different types of support and helps us understand where the gaps exist, right? And one kind of extra step that's important here is understanding that every individual offers a different type of support, right? So you can't go to the same person all the time. And often because we don't know that there are different types of support, we tend to go to the same person. And that leads to sometimes a sense of disconnect. An example I often give is, I'm a researcher, I'm a psychologist, I problem solve. I enjoy problem solving. I love puzzles, love fixing things. So when I'm feeling stressed, I usually know what I need to do. So the type of support I need is just somebody to listen. If I turn to my husband, the engineer, who also problem solves, well, guess what? There's going to be disagreement because I'm going to say, like, I know what I need to do, just listen, right? So maybe instead of turning to my husband, who's the problem solver, I might go to my best friend who I know is able to offer the emotional support. And so that understanding that people have a role, people have something that they want to do, you can sort of learn what is their style and then be better able to optimize how you engage with them. And this is also relevant for caregivers. Again, I use my children as examples often. And so my daughter loves telling me stories about kind of what happens with schools, and she'll tell me a whole lot of things happening, right? And my inclination might be to problem solve, but working a lot with adolescents, I know that that's not always the case. So that's not always the best thing for me to do. So I've taken to asking her, okay, do you need me to listen or do you need me to problem solve? Like what is it that you're looking or would be helpful to you in this situation, right? And vice versa. So if we can sort of recognize that needs may not always be clear, and if we're clear in what we want, or if we're unclear in what the other person is asking, then we're able to get our needs met. As I said, I use humor a lot. It's a wonderful strategy. We talk in this program about different ways we can use humor. And one thing that I often encourage individuals I work with to do, and again, I'm a person who does a lot of work with adolescents, I say, like, go to YouTube and Google tilt a squirrel. I think that's what it is. I promise you should really try this. It's hilarious. But essentially, it's taking that time out, pausing and taking a look at things in a different way, really fueling things like curiosity, right? Helps you shift away again from those things that otherwise hold us down. The next strategy we talk about in the program and we expand on is being mindful about how you speak to yourself. We don't recognize really how much of an impact our words have on us. We have so much compassion for others, but we don't see what it is that we say to ourselves. But that manner of speaking triggers that alarm reaction, making it harder to think clearly. So when you're feeling down, when you're feeling worried or frustrated, ask yourself, what self-talk are you engaging in? Are you being critical of yourself? Are you doubting yourself? Are you putting yourself down? Right? We often say things, especially when we come to living with rare disease, or if there's a new progression or a new diagnosis of sorts, we say, I can't do this. I can't. I'm not doing this right. And that's where I say, pause. You've done hard things. Yes, this is hard, right? But it's inaccurate to say, I've done hard things, or I'm not able to handle this. I can handle this, right? There's a situation. There's an example that I often share, and it's this idea between kind of coach A, coach B. It's a typical CBT technique, but it hits home this message. If you're coach A and you're telling yourself, you're horrible, you can't do this, I've given up on you. You can imagine if you were, let's say, an individual who's learning how to play a new sport, how you might give up and you might tell yourself, I can't do this. However, if you're more like the supportive coach and you say, you know what, I see you're trying and I'm so proud of you and we can do this together, right? The internal self-talk, if you're talking to yourself more in that way, you're going to see a change in how you're feeling and a change in what you're doing. And then acceptance is another one. And this is the last one I'll talk about today. Acceptance is not a single moment, it's a process. And often times I liken it to grief, right? Reason being is, people don't like using acceptance, so I use acknowledge. So I say, you know what, especially if there are changes within oneself, allow yourself to feel those emotions. Emotions are indicators. It doesn't mean being happy about the illness. It's recognizing the reality without letting it dominate your identity or sense of self, right? It's finding ways to find meaning and purpose. Maybe channel your experience into advocacy, mentorship, or creative expression. Reframe your illness as part of your story rather than your whole story. And remember who it is that you are. Your core self may not have changed, but there are other things that may have changed, maybe values. Identify your inner strengths. What makes you you? Are you big on family? Does advocacy invigorate you? Right? And so use those ways and things like the relaxation response to help move you towards acceptance. So there's evidence, you'll have this. There's a host of studies that are being done by our colleagues, certainly Dr. Park and myself, and many of our, Dr. Hall, many of us who are leading trials that are showing important impact that this My Smart program and has on multiple things, such as, certainly anxiety, distress, stress management, or rather stress coping. We see changes in even genomic behavior. We see changes in waitlist control trials that we've done with adolescent young adults that I led globally with adolescent young adults around the world. Changes again, similarly in coping, in worry, in coping with uncertainty, tolerance of uncertainty. The number of trials that we've done have been incredible. And so to bring this to a close, I have this here. This is not a cancer talk. This is a rare disease talk, but this is what we've got as, the closest thing to making a recommendation for the care of individuals, right? Cancer care today, and let's broaden it to the care for individuals living with rare disease, provides the best care when it comes to treatment as much as we can, but it doesn't address the psychosocial concerns, right? And this can lead to a significant impact on people's well-being. And what I would like to do, and what I'm advocating for, and what I'm trying to create, is to redefine how we deliver care for rare diseases so that we're, as it's indicated here in the Institute of Medicine recommendation, that there's just as much of a emphasis on one's emotional health as there is on one's physical health, right? So we need to change the paradigm of care so that we're addressing both and moving away from the typical deficit model, one that waits until people are clinically anxious or depressed, to one that's focused on a strength-based model, one that normalizes what it might be like living with rare disease and proactively offering people tools to improve their well-being. And that's how I define whole person care. And so back to why I start with rare conditions. While rare disease is rare, if you kind of zoom out, there's so many patients who suffer from them. And that broad impact that these diseases have increases the likelihood that there are going to be so many commonalities that we can pull from rare disease work to support other patients who are suffering from similar conditions. So let's learn how to improve well-being, and we can maybe make a broader impact across individuals who are suffering from other complex illnesses. And with that, thank you. Thank you for taking the time to listen. I want to open it up for any potential questions that people might have.
Thank you all for joining us. I think there are no questions. Oh, wait, in the Q&A, let's see. It says, okay, Annika. Okay, right now there are no questions. If anyone wants, they can put a question in the Q&A, but I wanted to thank Dr. Price for her time and for this presentation. Really an overlooked area, aspect of care, and thank you for drawing all the parallels between for patients with rare diseases and psychosocial needs and support. So I'm really looking forward to you to turning and the VHL work into really a national exploration, because I think you're one of the leading psychologists and investigators that are really interested in these populations. So I'm excited. So for folks who are here, thank you for joining, and stay tuned as her work with VHL continues. And thank you for joining HIPAA. We will continue to host these webinars, and you are on our email list. So thank you so much for your time. Take care.
Thank you, everyone.
Thank you.